There has been a lot of discussion lately about the food served in hospitals. There are many arguments from hospital administrators, that with their current budgets, they are not able to provide patients with locally grown food that is prepared in hospital kitchens. It is important that hospitals as public institutions are prepared to provide patients with excellent health care. Given the incredibly important role of nutrition as a determinant of health and the incredibly important role of the hospital as a role model and community leader. Food served in hospitals is now often produced in distant factories and shipped to hospitals frozen or chilled across the highways, rather than produced in local kitchens with fresh ingredients. Little or sometimes no cooking is actually done in local hospitals. Some long-term care patients will live the rest of their lives without ever eating a fresh vegetable again. All vegetables now come in a bag, frozen, and it is convenient, but they are so waterlogged with little or no nutritional value.
Hospitals in the most developed agricultural regions are not buying locally grown and produced food. Doesn't it make sense to buy food from communities nearby with higher quality, that we can work together to ensure that patients get well?
The healthcare system in Ontario is a major institutional purchaser of food. With 30,000 hospital beds and over 75,000 long-term care beds at close to 100% occupancy, the Ontario healthcare system serves an estimated 115 million patient meals every year. The value of this food is over $285 million, making this a very attractive market for locally based food producers and distributors. Hospital food has traditionally had a bad reputation, and for a good reason. Hospitals devote about 1% of their total budget to food, which breaks down to an average of $7.50 per day per patient, for 3 meals a day. Hospitals often take processed foods such as lasagna, cold sandwiches, canned fruit and jello as hospitals aim to feed patients in a way that is cost-effective and easy to assemble. Rather than serving good healthy nutritious food for chronic disease prevention and not food that health professionals strongly advise our patients to avoid. Hospital patients get too much salt even when they're on a sodium-restricted diet, says a Canadian study. On average, Canadians consume 3,400 milligrams of sodium a day, which is 1,100 milligrams over the recommended levels. At least 3/4 of that sodium comes from processed foods. Hospitals and other public institutions increasingly serve prepared foods instead of making them from scratch.
Foods shipped thousands of kilometers create carbon emissions. Some studies found that the food served in Ontario hospitals traveled an average of 4,500 kilometers and generated 51,000 tons of greenhouse gases annually. The hospital as a role model and community leader should consider all of these aspects and effects when they are making decisions, the impact on the environment, the local economy and employment.
Studies show that food waste in some hospitals is in between 30 and 50%. In order for hospitals to serve patients with high quality, locally grown and produced food, hospitals need to create efficiency in improving communication between departments. Synchronizing and speeding up communication between these departments will reduce unnecessary food production and will also reduce the cost of waste removal. Creating alliances with hospitals in the same geographical areas and negotiating long-term contracts with local suppliers and food producers will significantly reduce the cost of food.
Ready-to-use food is creating a junk food culture. Profit-driven corporations have focused the bulk of their efforts on creating and marketing highly processed foods that are loaded in salt, fat, sugar, and additives. The growing dominance of these foods has helped create an epidemic of obesity and ill health.
Outsourcing food services divert jobs from local economies. It is estimated that if every household in Ontario spent $15 a week on local food, there would be an additional $3.6 billion in the local economy and 15,000 new jobs would be created. Organizations should buy local food wherever sustainable alternatives can be found or created. Public sector dollars should be used to create jobs in local communities. Corporate food has created a globalized food system that has dramatically weakened local food infrastructures, local businesses, and has often exploited low-wage workers in other countries. Public sector organizations should work with local businesses, farmers, and organizations to help rebuild the local food infrastructure.
Above all, public sector organizations must focus on the contribution of food to health, well-being, and the creation of a new food culture that values fresh, nutritious, and locally prepared foods.
Believe me, everybody loves fresh food.
Everybody.